if someone would have came along after I fractured my back and said, hey, listen, yes, your back was fractured, but now what you need to do is the bone is healed, but you still need to do rehab. You still need to get stronger. There's certain things in your life that you need to avoid, like flexing all the time, so that you don't get a disc herniation like I had. What's up, guys? Dr. Justin Rabinowitz here, and today I have a special post for you where I wanted to share with you my story. So a lot of you guys have seen my posts and you've seen my videos before, and I try to put out a lot of content so that it can be useful to make you think about your health differently, and to just make you better as a human being. Today is a little bit different because I've realized that I might not have shared my story enough about why I do what I do and why I believe what I believe. So it's not just about me being a doctor or being in healthcare where I know all this stuff. The reason for all of this is because of my journey to get here. So for those of you that don't know, my journey to kind of figuring out this whole health thing started when I was 17. When I was 17, I was playing football, and during the middle of a game, my senior year, I got kneed squarely in the back. And like a 17-year-old with a lot of adrenaline does, I continued to play through this, right? So it really, really hurt me. I played another quarter or two until finally I collapsed in pain on the field. And I was taken back to the locker room. They did a urine sample on me, and I had pee in my blood. So they rushed me to the hospital because they were afraid that I had done something to my kidney. Which I did. I bruised my kidney, but worse than that, I fractured 2 bones in my back. And from there, doctors kind of put me in a back brace, and they said, you're out for 4 weeks. And then in 4 weeks' time, take the back brace off and you're good to go. So once the bone healed, they said you were fine. And so this is how it went. So basically I took the back brace off in 4 weeks. I went back out and I played football again. So the bone was healed and everything was good, right? Well, not so much. Throughout the next few years, what would happen is I was generally okay. I continued my baseball career in college. That was the other sport that I played. But about 3 or 4 times a year, my back would go out. And you guys all know what your back going out means. Your back goes out and you can't move, you can't bend, you can't twist. And I'm 17, 18, 19 years old. This shouldn't be happening to someone this young, but it kind of continued to happen over time. And I just could not figure it out. So, and it shouldn't be happening anymore because the bones in my back healed, right? Finally, I was going into this career of medicine, and when I was in chiropractic school, ironically, I was playing basketball. I went up for a layup, came down, and my leg started to go numb. Over the next 24 hours, my full leg went numb, down to my foot, down to my toe, and I was real scared because here I was studying all these different orthopedic tests and all these different conditions, and now I had one, and I had no idea what to do. And so I tried to get different treatments, and none of it seemed to work, and no one could give me answers. And so I started really doing my own research, all while being really scared and nervous and upset that I might not be able to even do the work that I had been going to school for because of this pain and numbness in my foot and in my leg. It got so bad to the point where, no treatment that I had found could really help me, right? So the treatment couldn't really help me, and I ended up getting surgery in the middle of chiropractic school on my back. Now, this post is not about whether surgery and good or bad or indifferent. This is not what this video is about. What it's about is understanding where I was in the world at the time and understanding exactly how that made me feel, that I understand when people are scared and when people are nervous, and I empathize with them because I was there myself. It's not something I learned in a textbook. It's something that I experienced one-on-one, firsthand. And so throughout that journey, what I really started to understand was that the system of how we treat people medically is essentially broken. Why do I say that? So a lot of people ask me, why I went into chiropractic school, and I always respond with saying, well, let me tell you about why I practice the way I practice rather than tell you why I became a chiropractor. Because the reason why I do what I do and why I'm so much about injury prevention and I'm so much into posture and ergonomics and healthy lifestyle is because how much of my journey could have been made better, how much of it could have been prevented if someone would have came along after I fractured my back and said, hey, listen, yes, your back was fractured, but now what you need to do is the bone is healed, but you still need to do rehab. You still need to get stronger. There's certain things in your life that you need to avoid, like flexing all the time, so that you don't get a disc herniation like I had, so that the muscles don't atrophy around your spine, so that your abs don't get weak, so that you stretch the right muscles over and over. Nobody was there to tell me that. Essentially, it was just, your back hurts, the bone is broken, okay, it's healed, now go back to doing what you were doing. And this is just, it just has driven me to kind of do what I've done in my career, because I just cannot see the logic behind telling any patient that. I believe that people deserve better than what I got. And so when in my office and with the way that I preach is not about chiropractic or physical therapy, about orthopedics or anything like that, not about acupuncture. It's not about the thing. It's about giving people the tools and teaching people the tools so that they can help themselves and understand that it's not always about leaving it up to the doctors or not leaving it up to the surgeons or the chiropractors or the physical therapists, and giving people the power and the learning and the understanding to do what they can themselves, right? Because I didn't know any of this. I had no idea. No one ever taught me. They just put a brace on me, and when I was done, they took the brace off and told me to go do it. So some people, they ask kind of, why do I spend so much time with my patients? Well, one of the reasons why I spend time with them is to help educate them. They ask me why I send 2 to 3 emails a week out to my patient list, why I make these videos every week, because I really believe that this is the best way that I can affect so many more people and help so many more people by spreading this message and allowing them to really help themselves, right? So I give tools and I can give exercise and I can give videos, but you really have to understand why I'm doing all of that. And it comes from a place of not wanting anyone else to be in the place where I was at one point. So I want to be able to share that with you. So I know this was a long video, I know this was a long post, but I really hope that you understand, based on my story, why I do what I do and how I think that we can all be better from getting that knowledge and just being more proactive about our health. And this goes for anything, not just back pain. It goes for nutrition or wellness or all those other things. So if you made it through this whole video, I know it's long, but please comment below and tell me about your own healthcare journey, where your frustrations are, or just like this video and share it with your friend who you might think needs something, needs a pick-me-up, please. And I appreciate you watching, and we'll certainly talk to you soon. Have a good one.